This is exercise 36. It's looking at the anatomy of the respiratory system. We can divide the respiratory system into the upper respiratory and the lower respiratory tracts. The upper respiratory tract is going to be composed of the nose, the nasal cavity, the paranasal sinuses, and the pharynx. And then the lower respiratory tract is comprised of the larynx, the trachea, and then the bronchial tree that we find within the lungs themselves. In this diagram or this picture, you can see where when you inhale, air is going to go in through the nostrils into the nasal cavity, down, then passing through the pharynx in the back, continuing on down through the larynx, then to the trachea, and then the trachea splits. Right at the split where it divides is called the carina, and you have the right primary bronchial tube and then the left primary or main bronchial tube. So those, after the trachea splits there at the carina, is where each lung is going to be fed independently. The left lung, if you notice from this diagram, is slightly smaller than the right lung. The left lung has 2 lobes, the right lung has 3 lobes. The reason the left lung is slightly smaller is to allow for the positioning of the heart in there. And then below the lungs, it's like they're just below them, they're setting on the diaphragm. If you look a little bit more detail here, you can see the nostril, you can see certainly the cross section of the nasal cavity, and then the pharynx is divided into 3 components as well. The nasal cavity here, you can see the ridges or the nasal conchae. You have a superior, middle, and inferior, and in between each one of them is a groove. It's the nasal mucus, which on a cadaver you can see this is what it will look like. In the nose, the septum is cartilage that divides or is between the 2 nostrils. It should be nice and parallel. In some individuals, they have a deviated septum. What has happened is that nasal septum is displaced. This may be genetic, or it could be due to trauma. If an individual has a deviated septum, some effects may be minor, others it may be quite severe, where it can lead to issues with breathing correctly, it may lead to snoring. On this diagram, you can see how it is not straight, and it's actually blocking, looks like the airflow coming in from one of the nostrils itself. It can be corrected by surgery. Sinusitis is inflammation that occurs and is blocking the drainage from the paranasal sinuses. It's usually due to infection that has then triggered the inflammatory response. What happens is you end up with mucus accumulating in the sinuses since it cannot drain properly. That's going to increase pressure, which then can cause a headache. Because the sinuses should be filled with air under normal healthy conditions, and it helps with your voice and the quality of your voice, because it's basically a resonance chamber, it can change the way your voice sounds. The pharynx is divided, as I said, into 3 parts. The uppermost superior portion is the nasal pharynx, right behind the nasal cavity. And then behind the oral cavity is the oropharynx. And then below that, most inferior, is the laryngeal-pharynx. In this diagram, you can see labeled the tonsils, the pharyngeal tonsils, the palatine tonsils, and the lingual tonsils. They are named by their location. If they become inflamed and start to swell up, that is what tonsillitis is. Their purpose is to help to fight infection of the upper respiratory system and also the upper digestive system. If they do become extremely inflamed and cannot allow the swelling to go down, they may be removed through surgery. The larynx is below the pharynx. You can see here in the red box where it includes the epiglottis. You've got the vestibular folds, the vocal folds, etc., to form what is commonly referred to as your voice box. In this anterior view, it is showing the positioning of the hyoid bone along with the cartilage, the thyroid cartilage, laryngeal prominence that help to form that larynx structure. You also can see on down to the tracheal cartilages. On the anterior view side of the trachea, there are alternating rows of cartilage. And this is a sagittal view of the same area. This is showing the epiglottis and then the glottis. The epiglottis is a flap that will fold down to prevent whatever you swallow, prevent whatever you've ingested, be it food or liquid, from going down the trachea and thereby making it into the lungs. Instead, it's going to push it back into the esophagus. The glottis is involved with the openings, as you can see, whether it's open or closed, and you get vibrations there through the folds, and that's what produces sound. So once again in this picture, you can see from the nostril to the nasal cavity, through the pharynx, down to the larynx, down to the trachea. The esophagus runs behind the trachea. And then, as I mentioned earlier, the carina is what you call the split of where that trachea now splits so that the air passageways can go onto the right and the left lung. This is a cross-section of the trachea and the esophagus. As I mentioned, the trachea is anterior or in front of the esophagus. The tracheotomy is an incision that would be made into the anterior wall of the trachea, and then you insert a tube in. This would allow air to enter the lungs if there is a blockage of the trachea. Now, what is causing the obstruction? It could be due to swollen tissues. It could be due to a foreign object that has been ingested. In this diagram, you can see once the trachea has split, you form the primary bronchus. As it enters into the lung, it forms the secondary bronchus, and then the segmental or tertiary bronchus. Basically, it's like a tree, it keeps branching, and the diameter gets smaller and smaller. From the tertiary bronchus, you move to the terminal bronchioles, which is even smaller in its diameter, to the respiratory bronchioles, down to the alveolar ducts. Where the alveoli are, the alveolar sac is this collection of all these individual little alveoli. That is where the gas exchange is actually going to occur. As you can see here, in the cross-section of an alveoli, that you have an extensive blood supply that is surrounding it. You also have typically a lot of macrophages present. That's so anything you inhale, if there's foreign substances, it can immediately detect it, attack it, and destroy it before it can penetrate even deeper into your body. You can also see how the walls of the alveoli are very thin. You've got the capillaries surrounding it so that you can have exchange of oxygen and CO2 occurring. The oxygen is going to flow from the alveoli into the blood capillary, and then the CO2, which is a waste product, will flow from the blood back into the alveoli to be exhaled. And in this diagram, it is showing how extensive those capillary beds are that wrap around the alveoli sacs so that you do have this good, efficient gas exchange occurring. When you look at the bronchial tree, we often categorize the airways. You know how we like to categorize everything. The conducting airways are from the primary bronchi to the terminal bronchioles. And that function there is just to distribute the air, bring it in and bring it out. The respiratory airways are from the respiratory bronchioles to the alveoli. And their function is not to distribute the air, but to have that exchange of carbon dioxide and oxygen occur. In terms of clinical manifestations, the diameter of the bronchioles, it's going to be controlled by the autonomic nervous system that's going to innervate the smooth muscle there. Bronchial constriction is narrowing, so there'd be less airflow. Bronchial dilation is going to be increasing the diameter and allowing for increased airflow. Pleurisy is an inflammatory response or condition with the pleural membranes. They start to swell up because they're inflamed. They're supposed to help reduce friction, but because they're inflamed, you have increased friction. The lungs are not able to expand properly to their full expansion capabilities when you inhale. So you're not able to inhale as deeply as you should, and it becomes very, very painful.